everybody. Today we will demonstrate the hands-on of Secret Duo, our latest system. We will use today in our patient our 3 handpieces. We'll demonstrate a treatment for active acne with our Smart Cure. Then we will follow with microneedling for the whole face, as we having a skin here which has a few issues, so we will address it differently. We're going to work as I will have here some pore problems, some oiliness, and as well I have some breakouts, acne scars also more on the sides, right? Over here as well. The rest of the skin, it's normal. I don't have an aged skin as you see, so rejuvenation on the area, addressing pores and oily skin, plus on the sides we have some acne scarring. When we finish, we're going to finish with an erbium fiberglass for a little bit of resurfacing, not very aggressive, but just to complete, to have a synergy in between the two procedures. So, fractional, CO2. So, we will do microneedling RF, combining with erbium fiberglass. First of all, let me show you how to insert the needle of the Smart Cure. Now, for the acne treatment, of course, we will use monopolar. The neutral electrode has to be held by the patient, right? And our Smart Cure, we will insert the AC1 needle into the Smart Cure handpiece. The handpiece is right here, Smart Cure. We will open it. You see it's open, it's unlocked. We have the needle right here. We insert it on the top, sure that it's completely inserted, and then we lock back the handpiece. So now we are ready to use it. I will just do an alcohol swab. Just I want to mention, our patient had already a BLT cream. We keep it for 40 minutes. We cover it with film, occlusion like for a better penetration and absorption of the cream. Consent form was already signed by the patient, and considering all that, we have also treatment log. Treatment log, I will fill it up with all the details of the session as the parameters I used on the specific area of the face with the respective needle, and as well with all the energies and with all the settings which we use. So in the second session, we know already what parameters has been used in which part of the area, so we'll know what to follow up. So I will use alcohol 70% minimum. I will wipe the whole face, and then we will go with the Smart Cure into the active pimples. We're going to use to remove those pimples which are disturbing her. So our needle, it's 30 gauge semi-insulated needle, 1.5 millimeter depth, as you can see, and it's not painful. It's not required necessary EMLA for use, but for the comfort of the patient, if you have pimples, put some EMLA localized if that's the only treatment you're going to do. Otherwise, you can apply EMLA, prepare her for a full patient, and adjust the parameters for the indications you're going to use. So I'm going to use the Smart Cure in a continuous mode, so I will just control from my finger and from my foot. I have a foot switch. So needle usually we insert it directly into the pimple, into the sender and the surrounding tissue. All the time we touch, we press to understand and to feel how big the pimple is inside. So the center has to be and the surrounding. If you have a small pimple, maybe one single shot it's enough. Otherwise, it doesn't matter how many shots, just to ensure that you cover properly everything. So let's start with some pimples in here. She have a small pimple. Those are relatively small. There is not much inside, so one, and they are gonna go. I have here one as well. If the pimple, they're already dry, inactive, they're already gone, it's not a problem. So you don't need to treat. Only what is actually active, inflamed, you have to actually treat. Over here we have a bit more. I have few which they have the tendency of coming. They are not out yet, but I can feel them under the skin, so I will treat those as well. Over here I'm doing few shots because there is a bigger pimple, so the surrounding tissue as well. And I'm having here some. This is gone, no more. It's just a bit of hyperpigmentation. This is a larger one, so 1, 2, 3 shots, it's enough. I have a little bit here. Here, there it's a bit more sensitive, so the patient might feel like a pinch. And because the pimple, it's inflamed, so already it hurts her a bit. Three shots I did over here. Yeah, and we have here one insensitive area, and it's relatively big, but I want to take it out. Oops. Sorry if it's a bit uncomfortable. Okay. So we finish. Now we're going to move on into the microneedling. So we have over here the tip. I'm going to use 25 for her. We have needles, we have 64 as well. I will use 25, non-insulated. So we will start the microneedling. We have inserted our tip. I will work first on the forehead, just as a rejuvenation, just simple, easy procedure. Then I will break in different kind of protocols for different kind of areas. Okay, so we are ready. Two passes, immediately done. So usually you can use minimum standard protocol, it's 2 passes. Problematic area you can do up to 3, 4, 6, depend on the situation or that indication which that patient has. So I will work this part. It's like a T-zone. She have a lot of pores, open pores, and a lot of oiliness. So I will work this in a certain parameter, and then we will do here some rejuvenation with tightening later on. So I will finish with this part first, and then I will do the lower part. I will do some extra passes where there is more pores, just because I want to have more needling and more energy delivered into the tissue. I want to have a less oil production, less sebum production on this area, because that's causing all these problems. Now I will do the lower part as a tightening and rejuvenation. Different parameters, of course. Of course, the parameters we're going to use will be so different from patient to patient. Also, the technique we're going to work the handpiece, it's different from patient to patient and the condition of the skin. For her, it's just tightening and oiliness and rejuvenation. But some patients, maybe we need more lifting, so the technique and protocol will be different. For those patients, some of them, they need more contouring because of age, you know, big cheeks, and then everything start moving down, so we need to have some contour. We can contour more, we can lift and tighten up here. Definitely we can help to open a little bit the eye when they have droopy eyes with the age. It's not our case, it's not our patient. Our patient has pores, post-acne scars, and some active acne, plus she needs rejuvenation. So tightening, I'm still doing it, as well as prevention and not only as a treatment. So we will continue again with different parameters for the T-zone, expand that here for her, and then again we'll do tightening and rejuvenation of this part. Just keep in mind that to have a perfect treatment, you always have to have the contact of the handpiece, the treatment area of the tip always in full contact. Never have the way in either direction. Yeah, the perfect penetration of the needle has to be done. Otherwise, you could easily create side effects if you don't have a full contact. So perpendicular of work in the handpiece, it's mandatory. Definitely, I'm demonstrating one part I work just in vertical lines or rows. Over here, I'm working in horizontal. It doesn't matter how you work it. Just make sure that at least 2 passes you make on the area, and where you have problems, you could continue. Just one thing, always remember, don't ever stuck. I mean, you will need to do 2 passes. It means that you have to go around or you have to come back later on. You cannot have 2 shots in the same time in the same place, like stacking 1, 2, 1, 2. No, you see, I'm going line by line. I will do 1 pass and then I will come again in the same line. I will do the 2nd pass. Over here I did more, as it's more problematic with more pores. Over here I don't have any issues, so I will just do the regular 2 passes. We finished with the microneedling, full face is done. You can see beautiful redness already. So now I'm going to use a line just to clean all this small pinpoints bleeding. As you can see, only in the thin area I have some bleeding points, tiny ones, especially also from the pimples I treated before. I will wipe with saline very well, and then I will mark the area for the erpium. Our patients start feeling some heat now. Erpium fiberglass, when we're working it, always we're using a zimmer. So a zimmer will be always on the skin, on the area we do the laser. You cannot do erpium fiberglass without zimmer or whatever other cooling device you're using, not only the zimmer. Zimmer is what we use. So our patient now is ready for erpium fiberglass. Here is the handpiece. This is the distance gauge. So just as starting, we have to work with the handpiece always in the contact with the skin. Always we have to respect the given distance. You cannot work from above, either 1 inch or ½ centimeter. It should be in the contact with the skin. That's the right distance for the laser. So I already marked the skin. Why I mark the skin? Now each one of you, you can mark the skin according to the way you like to work. So we're marking the skin to ensure that we don't have passes which we didn't do, or some parts to remain empty. Why? Because already we have done microneedling RF, so the skin is already red, so you could not notice any erythema or edema. So we have to be ensured that when we're doing the erpium, every single area it's completely covered. That's why I do marking. So this is according to the way I work. I like small areas to cover at once, and you can definitely start from whatever area you like, from the lower face or from the forehead or sides to the middle to the sides. It doesn't matter, as long as you cover properly and you do the same number of passes. I had already microneedling RF done, so maximum 2 passes I can work with erpium fiberglass. When you work it alone, only erpium fiberglass, you will need to have a different number of passes according to the skin, according to the endpoint you're looking for. So now we will do just 2 passes, horizontal and vertical, for each area. So we will be finishing. We're working with eye motion scanning. We're working with 1 by 1 square centimeter. Definitely we could choose different kind of shape. I'm working with square shape. You can have round, you can have triangle if you want to cover certain areas. And 1 stacking. So let's go. Now the smart cure for spider veins. So we just need to unlock. I prefer to put the needle from the top because the needle it's a 32 gauge, semi-insulated, very tiny, very small. So you have to put it inside here. Ensure that it's completely inside, then easily not to bend it. To close and lock the needle. Then we are ready now to use for spider vein for telangiectasia. In cases you want, you can use as well bending the needle. Bend the needle to 45-90 degree and you can use with the needle as well, bend it.